Well, we presented at ASCO 2021 our study evaluating the prognostic performance of Predict Plus in patients with HER2 positive early breast cancer. Indeed, we know that Predict Plus is a widely used online tool that helps to show how treatments administered after breast cancer surgery can improve the survival rates. And it was ultimately developed to aid the clinical decision-making in the adjuvant setting. However, its prognostic role was quite unclear in HER2-positive disease. So we aimed to investigate the prognostic performance of Predict Plus using the data from the ALTTO trial. And maybe the ALTTO trial was the largest study ever conducted in the adjuvant setting for HER2-positive early breast cancer patients. So what we did, we extracted the data from the patients enrolled in the ALTTO trial who received an anti-HER2 trastuzumab-based therapy, started concomitantly with the chemotherapy, and we calculated for each patient the estimates of survival by Predict Plus, and we compared this predicted survival with the observed survival of these patients. So in other words, we assessed the calibration and the discriminatory accuracy of Predict Plus. And overall, our analysis included 2,794 patients. And what we observed is that the Predict Plus in the patients enrolled in the ALTTO trial really underestimate the survival, with an underestimation that was relevant because it was approximately 6.7 percentage points in 5-year overall survival in the overall population. And this underestimation was consistent across all the subgroups we analyzed, with the largest difference between predicted and observed survival found for patients with hormone receptor-negative disease, for patients with node-positive disease, and for patients with the larger tumor size. So one possible explanation of this underestimation may be related to the fact that patients with the HER2-positive breast cancer are really experiencing a consistent shift towards better survival across the years. And this is mainly thanks to the therapies available in this setting. So it might be that this change is not reflected by a tool that was developed and validated more than 10 years ago. So the main messages that we wanted to provide with our work are first, that Predict Plus should be used with caution to provide prognostic estimation for patients with HER2-positive early breast cancer. And second, that we really need tools able to provide reliable prognostic estimations for patients with HER2-positive early breast cancer, because also in HER2-positive disease, prognostication has a paramount importance because it has several implications. For instance, the planning of a reproductive life in premenopausal patients, meaning that the prognostication can affect the choice of having or not a pregnancy. Or also, it is important from a therapeutic perspective, meaning the choice of adopting escalation or de-escalation treatment strategies. And yes, I'm also very happy and honored to say that our work was awarded with an ASCO Merit Award. And therefore, I really want to thank all the authors that participated in the study, and in particular, Dr. Matteo Lambertini and Dr. Evandro Diaz-Zambuja, who mentored this project. And also, of course, the Institute Jules Bordet, the Breast International Group. But as always, then the main thanks goes to the patients, so to the patients enrolled in the ALTTO trial and to their families.